Hi everybody, and welcome back to the Kiss Me Med Spa Aesthetic and Wellness Show, where we share with you what your options are to look good, feel good, and be good without any surgery. I'm Nurse Karen.
And I'm Dr. Barry.
So we are very excited to bring some information to you today on a product that is sweeping the nation. So before we dive into that, Dr. Barry wants to speak to us a little bit about the structure of the skin.
Yes. So today we're going to be talking about Sculptra. And so what I'd like to do is kind of give you an idea of the structure of the skin so you know where Sculptra is going to be helping your skin. So if you look at the picture there on the left, you can see a cross-section of normal skin. And I want you to, for purposes of the illustration, think of skin like a mattress. So Sculptra acts like a framework of the skin, and that is the collagen. So collagen is like the frame of a mattress, and that is what Sculptra is going to help enhance. The other things you see in the skin, you see little coils in there. That's like the elastin of the skin. That's like the coils in a mattress. And the little fluffy balls, that's like the fluff of the mattress. That's hyaluronic acid filler. Now, as we age, we lose all three of those components. They just become more fragmented. There's less of them. And so Sculptra is going to help rebuild that collagen, which is the framework of the skin.
That's great. So now that we are somewhat familiar, we can take that photo down, guys. Now that we are somewhat familiar with the structure of the skin, we're going to talk about Sculptra, what it is, the properties of Sculptra, all things you've ever wanted to learn about it. So, Dr. Barry, let's talk to our viewers about what this product actually is.
Okay.
By name, this product is PLLA, which stands for poly-L-lactic acid. And Dr. Barry is going to tell you a little bit more about it.
So that word probably is meaningless to most people. So what it is actually very finely micronized, dissolvable suture material. So if you've ever had a wound stitched and they put sutures underneath and they said, these are dissolvable, that's what it's made out of. So it's something that is not foreign to the body. The body is not going to look at it generally, unless you have an autoimmune disease, is not going to look at it as foreign. And it dissolves into very harmless materials of glucose, carbon dioxide, and water. So it's an interesting substance that's basically made out of suture material.
Yes, and Sculptra, believe it or not, is the second fastest growing aesthetic procedure or treatment in the country, second only to, guess what, everybody? Botox. Yes.
Botox, interesting.
Botox is always the number one, leading the race, but now Sculptra has stepped into second place. And that's why we're talking to you about it today. So when the PLLA, or the Sculptra, is suspended in sterile water, what we do is we inject it into areas of the face, or you can use it off-label in the body. And what happens is your body builds collagen around those little particles. So almost as if you were frying an egg. Let's say the Sculptra is the yolk of the egg and the new collagen is the white.
Yes.
Around. And so, people who have had Sculptra done have seen an improvement of over 65% of collagen build in their tissues at the 3-month mark after having this procedure done.
Very interesting.
That's amazing.
Mike, if you can pull up that picture that shows the micronized, yes, that one. So here's a great example where you can see what's happening. So these are the little micronized particles. You can see the needle going in, or it's the cannula actually, it's blunt tipped on the far upper right. So you can see the little micronized particles going into the tissue, and then you can see fibroblasts and macrophages moving in from your own tissue, and those are going to create the collagen around these little particles. And then the end result is going to be in the next slide, where you see the collagen being
Right,
built.
that's the photo that we want to
That's
use
the
right
one right there. So you can see the collagen being built. So there's a huge difference. And that's exactly what's happening in the skin. You see the collagen, or the framework of your skin, being rebuilt.
Great. So I too have a little photo I would like to put up. This photo is of three, it's really a drawing, it's of three women. We start to lose collagen after age 30, believe it or not. And then oftentimes we see people coming into the office, men and women alike, who are in their 60s and sometimes even into their 70s, who have never done any kind of aesthetic treatments to build collagen. And this is kind of a little example so that you can see how over the decades the percent of collagen loss that we get just from regular aging. So, and I think those numbers are actually a little bit conservative. If you have never done any kind of collagen stimulation at all, and you're in your 40s, you've probably lost 20 to 30%
Yes.
of your collagen that you had when you were young. And if you're in your 50s and 60s and you've never done anything, you've lost closer to 50 to 60%. And then when we turn 70, same thing happens. It
Right.
grows incrementally. So a lot of people don't realize that we begin to lose collagen in our tissues after we're about 30 years old. And what is it that collagen actually does in our skin? What can we see as,
So what
the
can
public?
you see as the result?
Yeah.
Well, when you have loss of collagen, your skin will be very thin, and you get that crepey look. And I
Ooh.
think everybody knows what crepiness is. Nobody wants crepey skin.
No, we don't
Crepey
want that.
skin, loss of the framework, plus loss of the elastin and collagen.
Yeah.
But the crepiness especially is what I think Sculptra really helps in the face and on the body.
Yeah, and we'll be talking about the body as well. So if you come into our office and you say, I want to do something with my face, I just feel like my face is falling down. I just feel like everything is just hanging here, and what can I do? Well, we will first ask you how you feel about surgery. Because if you don't have an aversion to surgery, oftentimes that is going to be your best bet to remove loose skin that's hanging down, because no treatments are really going to take that skin that needs to be cut off, and put it back where it used to be.
Right.
There's just nothing.
Yeah.
But a lot of people in this day and age really aren't interested in surgery. Or they'll say, yeah, I'm not interested in that right now, maybe sometime later on, but not right now. What can you do for me? So there are a lot of different ways to build collagen. Sculptra is one way, and that's what today's show is focusing on. So you've come into the office for a consultation. We have assessed your face, talked to you about what your options are, and if you decide to proceed with Sculptra as your collagen stimulation treatment, what we do is we as an office like to mix it 3 days ahead of time. So I brought some Sculptra today, which you can see right here. These are the vials. It comes with a freeze-dried powder in there on the bottom of the vial. So we like to put in some sterile water. Our office lets it sit for about 3 days before we inject it. And that's a very important thing, because some of the new research says you can inject it right after mixing it together. In our opinion, it's better and it's safer to let it sit and let it rest. That will help with homogeneity, which is a fancy word for breaking it down a little bit so that it spreads evenly within the
Yes.
tissues where we're placing it. Because there can be a problem if these particles are not placed evenly in the tissue.
Exactly. So a lot of people will say, well, I've heard of Sculptra, and I've heard a lot of people get these granulomas and these bunchy areas. Well, that's one of the problems. If it's not mixed well enough by the injector beforehand, that's where you get this lumpy, bumpy look afterwards. And there's a couple of other things that we need to discuss about what causes that.
Oh,
Okay.
well, maybe
So-
now's a good time.
Okay, so the other thing, of course, is your injector, okay?
Oh, yeah.
Are they placing it evenly and fanning it in properly, or have they put some in one place and not in another? That's a reason. So, injector skill is huge, okay?
And this does take skill. I mean,
Yes.
this is definitely not something that you would want a beginning injector or a beginning aesthetic provider to do on you.
No, so it goes in with a cannula, and you have to be, it takes a lot of hours to learn how to do that cannula properly, and so you can fan the product in. That takes skill, and beginning injectors cannot do that well.
No, there's no substitute for experience, for sure.
exactly,
I know
exactly.
I've been at this for 20 years, and
Yes.
you've been at this a long
Yes.
time too, so we do know a thing or two.
Exactly.
So we like to mix the Sculptra, as I said, 3 days before to let it sit. And then when you come in, we meticulously cleanse your face. We don't want any leftover residual makeup or sunscreen. We don't want to get an infection, so we are going to definitely meticulously cleanse your face. And then we're going to kind of play with your face. And if I could touch Dr. Berry a little bit here. We're going to see where is a good area to get this blanket of collagen build. And we're going to mark that out, and we're going to draw on your face. Then we're going to do some little numbing shots for the port where we're going in to place the product. And then we're just going to go in and we're going to fan that product evenly and nicely around those areas. Nurse Regina at the office likes to say that the result you get from this is a blanket of collagen build. So being that you get this blanketed effect, an overall improvement, it's going to give you a great foundation for the other things that someone might need to do, and we'll be talking about that as well. So after the injection, then what we do is we clean off all of the markings, we get some sterile Vaseline, we set a timer, and we go to work aggressively massaging the area that we treated. And Dr. Berry, just one more time, let them know why that is an important step.
So this is important because you want it evenly distributed. If you don't do that, then you're going to end up with one area with more product than the other.
Yeah.
And that's where you get those lumps that some people have heard about. That's one of the reasons,
Yeah. So we're going to set the timer, and then you have some homework to do as
Yes.
well. And this is a very important thing that Dr. Berry and I were talking about. When you are at home, there is the rule of fives, and she's going to tell you what they are.
So the rule of fives, and it's very important, is you have to go home, you have to massage the areas 5 minutes, 5 times a day for 5 days.
That's right.
Okay? Now, if you think that is easy,
No, it's not.
it is not. You have no idea how long 5 minutes is, because we have both done this. And when you're doing it, you go, I'm pretty sure that's 5 minutes. Like, no, that's only 2 minutes in.
Yeah.
It is a commitment. And if you're not willing to make that commitment, you should not get this product, because then your placement and, uniformity
Yeah.
cannot be guaranteed if you're not willing to put that effort in. It's a big effort.
It is definitely a step that you're going to have to commit to. So we will ask you, are you willing to massage your face 5 minutes, 5 times a day for 5 days? And you have to do it by setting the timer. I tell people don't use moisturizer because that
Nope.
dries out. Don't just do it on dry skin. I like to say take some Aquaphor or take
Yep.
some Vaseline because it's very slippery.
Yep.
And just set the timer and watch TV and go to
Yep.
town just aggressively massaging. And then your results are going to be beautiful if you do that. That's part of the post-care. There's some other things that we think you should avoid even before getting this done. If you can avoid taking any blood-thinning agents.
Yes.
Alcohol thins your blood. Sorry, it really does. So we want you to abstain from drinking alcohol for a few days before. Ibuprofen, Aleve,
Yes.
fish oil.
Aspirin,
Yes, aspirin for sure.
for sure.
We would ask you to avoid that for a few days. Now, if your physician, though, has put you on a daily anticoagulant or something like that, we would never tell you,
No.
hey, just quit taking that without talking to your doctor.
Yeah, it's not a contraindication. The
Right.
only thing is you might get a little more bruising. We don't like bruises, but we don't want you to go off prescribed medications either.
We don't. And I want to talk about bruises for a moment. You know, anytime you get a poke with a needle in the face, okay, you are most likely going to get a bruise. Sometimes we don't get bruising, but oftentimes we do. So oftentimes clients will ask, am I going to have bruising? And you know, at that point, I really have to tell them, and you've told them a million times, yes, you most likely are going to have bruising, but the good news is the bruise will go away. But to expect that you're going to have all of this activity going on in your tissues and not end up with any bruising whatsoever is to be disappointed.
Yeah. Now, I am actually surprised, you know, with cannulas, how little bruising there is. I'm always amazed by that.
Yeah.
Usually it's just a little bit of, you know, the initial porthole where you get bruising, but those cannulas are so beautiful. There's really very little bruising with that, I've found.
Right, but there can definitely be some. So we definitely want to have this treatment done when it's a convenient time for you. If you're going on a vacation 5 days later, 3 days later, we don't think that that's a good time to do it. If you have an event, that's not a good time to do it. We would like to do it when you really don't have anything special going on for 2 or 3 weeks. You know, that way any swelling or any bruising has settled down and you're done with your massaging and the timing was perfect.
Exactly.
Right? So what are some of the results that you can expect after getting Sculptra? So over the course of several weeks to about 3 months, you're going to see a marked improvement in the laxity of your skin. Not only will your skin be more firm, you're also going to get what is called the Sculptra glow.
Yes. Now that I can definitely attest to. So for myself personally, I don't like a lot of filler in my face because my face has always been chubby.
Yeah,
and
kinda like
I'm
mine.
happy to have it thinner. So, but I didn't like the crepiness that was developing on my
Yeah, when you
cheeks.
smile, you get these
it's just
crepey,
all
ugly lines
lots of
here that nobody
crepiness.
wants.
So what I loved about the Sculptra is how it completely erased the crepiness. It just
Yay.
really peeled the years off.
Ooh, we
and
like
the
that.
skin has really an amazing glow kind of from the inside that's hard to describe.
Yeah, but everybody seems
Yeah.
to get it, and
Yeah.
their face just looks like it's beaming and glowy, and it's so beautiful.
It's a wonderful product.
Yeah. You'll also see improvement in fine lines. And another thing that we have noticed recently are patients that get Sculptra done, if they have acne scars, they are really diminishing the
Yes,
acne scars.
yes.
So talk to us a little bit about
Yes.
that too.
Because, you know, in acne scars, there's loss of collagen, and a lot of them are sort of bound down. So when you go in with a cannula and then you lay in a biostimulator, which is a collagen stimulator, it is going to go into those areas of scars and just put collagen where it hasn't been. And it really is amazing for acne scars.
It is, and honestly, we as an aesthetic office, we're looking more for tightening of the skin because, you know, that's why people come and see us. They want to lift my skin, you know, help my neck, do my jawline, you know, everything. Everybody wants lift to the face. And then we started to notice in these before and after photos that we're going to show you later that the acne scars were really filling in, so that was an added plus. So now this is part of our protocol for treating acne scars.
It's
As
wonderful.
well. Sometimes people will ask us, how long are these results going to last? Everybody wants to know, how long is this going to last? How long is that going to last? Well, if you get full correction with your Sculptra, which can take 1 to 3 times of getting it done, all that depends on how much collagen you've already lost and if you have done any collagen stimulating treatments prior to getting your Sculptra. But whenever you get full correction, you can pretty much count on that lasting about 2 years.
Oh
What
yes.
do you think?
Oh yes. I had mine like about a year ago, and it still looks like
Still going strong?
95% of what it was. Yeah.
That's great. And I didn't do it in my face because, you know, I have a full face as well. But I did it on my upper arms. I did not like the crepiness that I was starting to see on my upper arm. And we live in a desert where it gets hot. and everybody here wants to wear sleeveless clothing. And so I had Sculptra done in my arms, and that's been about 3 years now, and I can honestly say that I still think I have some effect from it, but definitely at the 2-year mark, I felt like it still looked really good, and I didn't need to repeat it again, and I actually only did it the one time. Now, I will say I use my arms a lot. You know, I dance, I use my arms, you know, I'm working all the time with my arms, so, you know, they do get a lot of use. But if you are kind of a sedentary person, you probably will have to repeat the treatment more than one time to get, you know, full correction. So that's good news. There are no fillers that are really going to last as long. These hyaluronic acid fillers last as long as a Sculptra treatment
Well, it's
will.
just completely different because you're rebuilding the collagen framework, whereas hyaluronic acid is giving you volume in places where you've lost some volume. So, like the mattress analogy, it's just completely different.
So people will ask us that, am I still going to need to get Botox and fillers done if I do Sculptra? So Dr. Berry's going to talk to us a little bit about that.
So I guess it would depend what you want, because you can have beautiful skin, but if you've had a lot of volume loss in areas, you may need to have a little bit of filler put in some areas just to replace bone loss, fat loss. And also there's no replacement for Botox, because
Right.
Botox basically relaxes muscles that are creasing in ways that we don't like. There's nothing wrong with the creasing on our face. It's just we don't like it.
Right, we
So
don't like it.
the only way to get rid of those frown lines and the creasing lines is just to soften those areas with Botox. So that's a completely different ballgame.
And when we say Botox, we also
Yes.
mean products by Galderma, who is
Yes.
the, you know, the people who have Sculptra. Dysport,
Right.
Xeomin is one. There's new competitors coming out all the
Right.
time, but everybody calls it
I just always
Botox.
say
Yeah,
Botox
even though
because
they're not,
everybody knows.
you know, that's the name everybody recognizes. Another question we'll get asked is, well, what areas of my body can I get this done? Depending how you mix it and depending on the expertise of the injector, you know, it can be done in the cleavage lines here to help fill those in. Now, these are off-label, okay? The company doesn't stand behind this, but I'm telling you what people out there in the field are doing. The arms, like I had. There's a very famous social media person that most people follow and emulate who had quite a few vials of this Sculptra put into her butt cheeks to give them more of a curved effect. Now, she had way more than this. I actually know how many she had, so I can't tell you, but it was a lot. Yeah, but you know, Sculptra can be used to help smooth cellulite, crepiness on the legs, the thighs, around the knees. All of these are off-label areas to treat, but what we're doing is we're taking the product and we are building a blanket of collagen to improve that crepiness and to tighten the skin. So it's really pretty amazing. Another way we can use Sculptra is if we have patients who have opted for liposuction. Oftentimes when they go in with the cannula and they're, you know, you've seen it on the videos, right? It looks
Yes.
kind of barbaric. You're oftentimes left with some divots. A divot is like a little dent. And that's because, you know, they're taking that cannula and they're just blindly sucking out fat, and sometimes you get a little too much that comes out of one area adjacent to another area. So if we take a little bit of the Sculptra, we can put that in there and kind of fill in that
Yes,
divot.
that is a great
Oh,
point.
that's a great way to
That's a
use
great
it. I mean,
point.
this is just such an
Yeah,
amazing product.
It really is.
Yes, and we've talked about how even though you get Sculptra, if you have deep nasolabial folds, if you have marionette lines here, if you have tear troughs that, you know, are deplete and have lost volume, there's also something called the nasojugal groove that comes down here. That happens because your fat pads that used to be like this when you were young, as we get older, they pull apart. I call it like the great divide when I'm trying to explain what happens to people. Sometimes you really have to put a little filler to just connect those fat pads back together. But Sculptra is a great place to start because it is a very natural result. I've not seen anybody look like a blowfish,
Nope.
overpuffed, overdone. In fact, because it takes up to 3 months to get your full result, people love that because you don't come in one day and the next day you go back to work and everybody says, "What'd you do?"
Exactly.
Yeah, and most people don't want that. You know, people like to kind of keep it quiet what they're doing, but with Sculptra, it gets better and better and better. Now for the bad news. We have to tell our viewers who cannot have this wonderful product.
So if you think about this product as being dissolvable suture material, so it's going to be people who have trouble with sutures. So people who have hypertrophic scars or keloiding scars, it's really not recommended at all, because you're going to get an unpredictable, overexuberant response, because your body is basically an overachiever when it comes to building collagen.
Yeah.
Okay, so that you should really not do it. And the only other people are people with autoimmune diseases, because people with autoimmune diseases, their immune system is confused. It can see something fairly benign and just over-exaggerate a response. Now, interestingly, people who are immune suppressed, they can have it. For example, Sculptra has been used for decades in people with fat loss from HIV disease. So you can be immune compromised, but you can't have an active autoimmune disease.
Overactive immune system.
You cannot have an overactive
Because it's going to
immune
make
system.
too much collagen, is what
And
we're saying.
in an unpredictable fashion.
Yeah, in fact, I have seen patients who have a condition called scleroderma, where they produce too much collagen and too much tissue. That would be a nightmare to put Sculptra in somebody
that would
like
be
that.
really
We just wouldn't
not
want to do
good.
it. So, the average cost for this treatment, everybody wants to know, well, how much does this cost? It's definitely less than $2,000 for a treatment, and that may just have to be repeated as, often as you need, but I personally, as we're getting older, if I have older patients, I want to wait at least 3 months to do a repeat treatment. For some of the younger patients, they can do another treatment at 6 to 8 weeks. But generally, I'm very comfortable with 3 months later. Now, we do have some photos of someone that we want to put up so you can see a picture 3 months after her Sculptra treatment. So if you look around the mouth, look around the nose, look around the jawline there, in these photos that we're putting up, you can definitely see a much firmer, tighter, younger look. That's her from the side, and then we actually have another photo of her from the front. Beautiful results.
So,
Look at that difference.
I think that shaved 10 years off her face.
Definitely. And she's thrilled. She's just
I would
loves
imagine.
these results.
And it's so natural looking.
Yeah.
You see how you don't have any areas where someone might say, oh, you had filler or something.
yeah,
No.
the cheeks aren't super
No.
full like baseball cheeks.
No.
It just looks very natural and very beautiful.
That's a wonderful result.
Yeah, you can tell that Dr. Berry and I and all the staff at Kiss Me Med Spa, we love this product. So, if you're interested in seeing one of our providers to talk about if this might be right for you, please give us a call at 559-838-0500. We'll get you in for a consultation. We'll go over all these things again with you on a one-on-one basis, and we will help you on your journey to looking good, feeling good, and being good. Thank you so much for watching our show today on Sculptra, and we will see you next time. Bye-bye.
Bye.